I like playing golf, grew up playing softball. I like to sing, you know, I'm a
Karaoke or?
bathroom singing.
Bathroom singing, okay.
Or in the basement singing. A lot of men have a fear about prostate cancer. And so the best way they deal with that is to not deal with it at all. So the symptoms of frequent urination, you know, getting up in the middle of the night once or twice, I couldn't get no sleep. You know, so now I go to work. You know, I'm tired of work because I'm getting up early and I'm doing the same thing there. I'm going to the bathroom. And it becomes so common that you don't realize the decisions that you now make based on the bathroom. You know, do you want to fly? Do you want to drive a car? Okay, we're going to drive. How many stops am I making along the way? You know, what route am I now taking so I can get off the road to use the bathroom? And just dealing with it is just crazy. Dr. Schenk told me about the Da Vinci surgery and talked to how it was minimally invasive. What I loved about the surgery was the surgery gave me a second chance.
Michael is a good candidate because he's in good health, he's in good shape, he has a long life expectancy, and he should be cured with whatever single modality of treatment that he chose. He chose to have surgery because he thought it gave him his best chance of curing his cancer and was also looking to minimize the side effects of the treatments. Any case that we would do through an open incision, we can now do through keyhole incisions, which usually allows for quicker recovery and faster return to normal function after patients' operations.
You had these claws that would push away your vessels and your muscles, and therefore not having to cut through anything. And you know how sensitive your veins and all that stuff is.
These are delicate nerves. They are operated on. There is some stretch. They need to heal, but that healing takes place over a period of time. What we are seeing that's exciting with the robotics is that much earlier on in that recovery phase, we're seeing men coming back that are potent and sexually active. So we're doing a good job with cancer. We're doing a good job with regard to the urinary control, and we're starting to see improvements in terms of potency at an earlier stage.
I had my surgery in June. This is December. I feel as if I hadn't had a surgery. My incontinence maybe lasted for a week after my surgery. I went out and bought all these diapers. At home, I still have all these diapers. Don't need them. I've been back out golfing again. My wife and I love to go dance, and all those things that I was doing, I'm doing again. When I go out there and play golf, you know, before the prostate, I was always looking for that little bathroom, you know, somewhere on the golf course so I can kind of run to it. Now, I just go ahead and play golf and I just have a good time. You know, I mean, it's like back when I was a little kid. Had all this energy. Going to the bathroom was not the biggest thing on my mind. It was staying in the game, staying in the mix. You know, I recommend this if you're kind of deciding whether or not you want to have the Da Vinci surgery. In my mind, there really isn't a question. This is the way that you ought to go.